Hello, everyone. I hope you've been enjoying the morning. So as you can see, we talked a lot about African American men's health. We talked about prostate health, prostate cancer, and clinical trials. And we had two wonderful physicians and a great moderator. So we thank Dr. Campbell, Dr. Johnson, and we thank Jamal Grooms for joining us for those conversations. So see, African American men, we are showing you love here at BlackHealthMatters.com. Now we're going to talk about breast cancer, which is something that more African American women need to learn about. And I'll tell you a little bit about our presenter in one moment. But let's look at the statistics. African American women are often diagnosed with breast cancer at younger ages and with a more aggressive form of breast cancer. African American women are often diagnosed at later stages when treatment options are limited. African American women have a 39% recurrence rate. So now we know the stats. The good thing is that we have Dr. Newman here, who's going to show us reasons for us to be hopeful and to be empowered about our sisters who have breast cancer. So let me tell you about Sister Warrior, Dr. Lisa Newman, who's very active in the breast cancer community. She's just a dynamo, so we're thrilled to have her. Dr. Lisa Newman is a surgical oncologist with a clinical and research practice dedicated to breast cancer management. She practices with Weill Cornell Medicine at New York Presbyterian Hospital Network. And now I am pleased to introduce you to Dr. Lisa Newman.
Thank you so much for that beautiful and very kind introduction, Rosalind. So I am going to go to the share screen mode.
All right.
Okay, are my slides showing up? Okay, so I am very, very honored to be able to meet with everyone today. And this session that Black Health Matters has put together on breast cancer, and in particular focusing on the breast cancer burden of African American women, is indeed very timely. I do want to emphasize what Rosalind already mentioned, which is that we do have some good news. Thanks to breast cancer early detection with screening and advances in treatment for breast cancer, we are seeing declines in breast cancer death rates. However, it is still heartbreaking that approximately 40,000 women will die from breast cancer every year in the United States. And some of those deaths can be prevented by maximizing on the benefits of early detection and screening programs and maximizing on the advances in treatment that we've made in breast cancer. In terms of early detection, it can't be emphasized strongly enough how important it is to catch a breast cancer early. These bar graphs are depicting the fact that when we catch a breast cancer at a small size, the stage 0 and stage 1 breast cancers, the stage 0 breast cancers are actually pre-malignant cancers of the breast. When we catch a cancer at these small sizes, early stages of disease, the very high majority of women will be long-term survivors. Unfortunately, however, there are still women who continue to be diagnosed with the bulkier cancers and the cancers that have an inherently biologically more aggressive pattern. And for these types of diseases, unfortunately, the breast cancer survival rates are not quite as good as when it's caught at an early stage. So it is indeed very important for us to be quite vigilant about our own breast health so that if there is a problem brewing, we act on it early, catch it early, and then implement appropriate treatment efficiently. So it is quite appropriate for us to ask the question, well, which women are at higher risk for getting breast cancer compared to other women, so that we can try to identify the women that do need to be even more vigilant. So this is where we talk about breast cancer risk factors. And there are indeed several clinical and pathologic features that identify women who are at higher risk for getting breast cancer. In terms of clinical features, the aging process is actually the strongest risk factor. And for all women, no matter what your racial ethnic identity, no matter where you live, as we get older, breast cancer is a larger problem. It's a bigger threat to us. Family history is important. Women that have several members of their family with breast cancer, especially if those breast cancers in the relatives were identified at early ages, ages younger than the menopausal age, and especially if there were features such as a bilateral breast cancers occurring on both sides. If there are men in the family with breast cancer, these are indicators of women that are at higher risk for getting breast cancer themselves. Menstrual history plays a role, and in general, women who have longer lifetime exposures of their breast to hormones from the ovaries tend to have a slightly higher risk of breast cancer. And so women who start having their periods at very young ages, women who continue having their period until they reach a late age at menopause, and women who don't have any interruptions of their periods through pregnancies, these women do have a slightly higher risk of getting breast cancer. There are also histopathologic features that we need to look at. And by histopathologic features, I'm talking about patterns that are identified on breast biopsies. So many women will need to have either a needle biopsy or a surgical biopsy of a problem that's been identified in their breast. And it's of course wonderful news if they're told that the biopsy was benign and did not show any cancer. But it's very important for that woman to know exactly what was found on her breast biopsy, because there are some benign patterns of abnormal proliferation, or basically overactive breast tissue, that will identify a woman who is more likely to get breast cancer in the future. And then those women will be candidates to possibly take medication to lower their chances of getting breast cancer. These women are candidates to be more aggressive with their screening practices, and that may influence the pattern of mammogram scheduling, and they become candidates to get special imaging such as breast magnetic resonance imaging or breast MRI. There are also lifestyle factors that can influence the likelihood of getting breast cancer. It's very important to follow a healthy lifestyle, staying fit and avoiding a sedentary lifestyle, being active, following a good, healthy, balanced diet to avoid obesity, especially in the postmenopausal age ranges. Those are very important messages to avoid a breast cancer diagnosis. It's also a good idea to avoid supplemental hormone medication in the postmenopausal age ranges. So postmenopausal hormone replacement therapy increases breast cancer risk. And everything in life is about moderation. Excessive alcohol intake is also a risk factor for developing breast cancer. Nonetheless, it's also important for us to accept the fact that approximately 75 to 80% of the women who are diagnosed with breast cancer don't have any of these identifiable risk factors. And so all of us as women need to be on the lookout for a breast problem and act upon it promptly if we notice any symptoms. So how do we try to detect a breast cancer at early stages? Well, one way is through breast self-examination and checking your own breasts regularly to see if you've developed any danger signs or any lumps, which we will talk about later. Clinical breast exam, seeing your healthcare provider, whether it's a breast specialist or your gynecologist, simply making sure that your primary care provider does perform a good clinical breast examination on you at regular intervals is another way to be vigilant about your breast health. And then screening mammography is the most widely touted mechanism for early detection of breast cancer. And we'll talk about that as well in greater detail. Now, when it comes to screening mammography, however, we are talking specifically about women that don't have any changes on their breast exam. Once a woman does develop a new lump, either on her self-exam or by her physician, it doesn't matter when she had her most recent screening mammogram, that woman does need to go through a full evaluation of whatever danger sign developed. In terms of self-awareness regarding one's breasts, the key message is that none of our breast imaging modalities are perfect. Mammograms can unfortunately miss cancerous lumps in the breast, and so women do need to be aware of the danger signs of breast cancer, even if they have had normal mammogram imaging. The danger signs are as follows: a new lump in the breast, a bloody nipple discharge, changes in the skin appearance of the breast, such as redness, inflammation in the skin, swelling in the skin of the breast, or sometimes it can look like a rash or eczema type changes in the nipple areolar skin. Developing these danger signs doesn't necessarily mean that there definitely is a cancer present, and there are many benign, non-cancerous explanations for these types of symptoms. However, when these symptoms develop, it should prompt the woman to seek medical attention right away so that the symptoms can be thoroughly worked out to determine what is going on and to determine what the cause for the symptoms are. The only way to conclusively, to definitively diagnose a breast cancer is with some type of breast biopsy. And a breast biopsy means that a piece of breast tissue is being removed so that it can be analyzed under the microscope. Sometimes a biopsy is in the form of a surgical procedure, sometimes a needle biopsy, sometimes in the form of what we call a punch biopsy, where a small piece of skin is removed from the breast. But a biopsy is the definitive way to diagnose a breast cancer. Once a breast cancer is diagnosed, there are 3 principles that need to be addressed in order to make sure that that cancer is taken care of properly. You want to get rid of the primary focus of disease, the cancerous lump, and this is why most women with breast cancer do need to have some surgery. But also with breast cancer, the entire breast has to be treated because most women will have microscopic invisible breast cancer cells hiding in the normal appearing breast tissue. So we can achieve those 2 goals by performing a mastectomy with complete removal of the breast, or by performing a lumpectomy and then giving radiation treatments to kill the microscopic invisible cancer cells in other areas of the breast after the lumpectomy. And then in most women with breast cancer, we will need to surgically check the lymph nodes or the glands of the underarm because that part of the treatment helps us to decide whether or not therapy such as chemotherapy will need to come into the picture. So today we have the breast conserving surgery as an option for breast cancer management, which is the lumpectomy and radiation. We have mastectomy, which can often be coupled with breast reconstruction performed by the plastic surgeon. Often today we can do a nipple sparing mastectomy, which results in a beautiful reconstruction result. And reconstruction can either be done at the same time as the mastectomy, or it can be done in a delayed fashion. And as I mentioned previously, axillary surgery is usually necessary to evaluate the extensiveness of the cancer. We also look at biomarkers on the cancer to also help us decide on the aggressiveness of the cancer. And these biomarkers are things that we refer to as the estrogen receptor, the progesterone receptor, and the HER2/neu marker. We can also do special studies called gene expression profiling to give us even more precise information regarding the biologic aggressiveness of the cancer. There are some women where we do have to recommend a mastectomy as opposed to a lumpectomy. And this is sometimes a difficult decision to make. The woman who chooses breast conserving surgery will need to have ready access to the radiation facility. Sometimes a tumor lump is simply too large to be able to offer the woman a lumpectomy that would leave her with an acceptable appearing breast, but that has to be defined by the patient. Sometimes we see signs on the mammogram indicating a patient that is not necessarily a good candidate for lumpectomy. And again, early detection saves lives. If you catch a breast cancer early, you are more likely to be treated successfully with breast-saving surgery. If you catch a breast cancer early, you are a better candidate to have breast reconstruction at the same time as the mastectomy. Catching a breast cancer early reduces the chances of needing chemotherapy, and it can also reduce the chances of needing more extensive lymph node surgery. For screening of breast cancer, we recommend that mammograms be performed every year beginning at age 40. Women with a strong family history of breast cancer diagnosed at young ages might need to start their mammograms at even earlier ages. These are just a couple of examples of mammograms that I'm going to show you. This mammogram is in a woman who has a fairly bulky cancer in her right breast. This is what we call the craniocaudal view. This is the profile view. This is a fairly advanced breast cancer, unfortunately. In contrast, some women will be found to have these little tiny spots on their mammogram called microcalcifications as an early sign of breast cancer. And this type of a breast cancer can be treated very successfully with breast-saving surgery with a lumpectomy. Now, focusing on the issue of breast cancer in African American women, as Rosalind mentioned previously, death rates from breast cancer are higher in Black women, and that's partly explained by the fact that we tend to have breast cancers diagnosed when they are bulky or larger sizes. And a lot of this is explained by the fact that poverty rates are higher in the African American community, and so we tend to have more barriers to accessing the healthcare system. However, there are several features related to the breast cancer burden of African Americans that can't be explained by socioeconomic disparities. For example, we tend to be younger when breast cancers are diagnosed. We tend to have these biologically more aggressive tumors, such as the triple-negative breast cancer that we will discuss, and inflammatory breast cancers. Lastly, male breast cancer is also more common in the African American compared to the white American community. And so we do need to look at tumor biology and genetics when we also try to explain all of the variations that we see in breast cancer between Blacks and whites. This is simply a photomicrograph showing you what a triple-negative breast cancer looks like under the microscope. Triple-negative breast cancers do not express those three biomarkers that we mentioned, the estrogen receptor, the progesterone receptor, and the HER2/neu marker. And triple-negative breast cancers are inherently more aggressive cancers. They are twice as common in African American women compared to white American women. And they are associated with higher risk of hereditary disease. Now, we mentioned in the beginning that death rates from breast cancer have been declining, and they have been declining in Black women as well as in white women, but not to the same extent in Black women. In Black women, we have also been seeing, as shown by these curves on the left of this slide, a disproportionate rise in the incidence in the detection of breast cancer in Blacks compared to whites. And these higher detection rates, coupled with the higher frequency of triple-negative breast cancers, is leading to a widening in the mortality gap. And now we see 40% higher death rates from breast cancer in Black women compared to white women. Again, screening mammography makes a difference. These are data from a study that we conducted in Detroit, Michigan, showing that for triple-negative breast cancer patients, if you were African American or if you were white American, the best survival was if that triple-negative breast cancer was detected on a screening mammogram. Survival rates worse if the triple-negative breast cancer was detected after it had already caused symptoms. These are some data from an international breast cancer research program that I've had the pleasure of leading over the last 16 years, where we have looked at the breast cancer burden not only of African American women and white American women, but also from women in Ghana, representing West Africa, and women from Ethiopia, representing East Africa. And this is what we see in terms of frequency of triple-negative breast cancers. About half of the Ghanaian West African women have triple-negative breast cancers. Triple-negative breast cancers occur in only about 15% of white American women, and the frequency of triple-negative breast cancers in African American women is intermediate between what we see in Ghanaian women and what we see in white Americans. Frequency of triple-negative breast cancer is actually quite low in Ethiopian East African women. So we think that this is more evidence of the fact that there is some inherited predisposition for triple-negative breast cancer related to African ancestry and specifically related to West African ancestry. As all of you are aware, the transatlantic slave trade from several centuries ago brought the ancestors of contemporary Ghanaians, West Africans, across the ocean to serve as slaves in the Americas. And so as African Americans, we have quite a bit of shared ancestry with Ghanaian, West Africans, the slave trade from East Africa and Ethiopia was largely controlled by Arabic traders, bringing East Africans further eastward to the Mideast and to India. And so as African Americans, we have less shared ancestry with Ethiopians. And so now our International Breast Cancer Research Group is looking into the genetics of West African ancestry to explain these risk factors for developing triple negative breast cancers. And we have actually identified some markers that seem to be quite promising in being the features of interest. So our international studies have been very exciting from the research prospects, but we are also very excited about using these international global partnerships to elevate the quality of care delivered in these heartbreakingly underserved communities in Africa. So I just have a couple of minutes left, and I want to go through just a few common questions and concerns. Does breast pain indicate that I have breast cancer, or does breast pain indicate that I don't have cancer? There's actually no definitive association between breast pain and the presence or absence of a cancer. So if you develop any of those danger signs that I mentioned previously, a new lump, bloody nipple discharge, change in the skin of the breast, see your doctor right away, regardless of whether or not you are experiencing pain. Should I get mammograms more frequently if I have a family history of breast cancer? If you have relatives diagnosed with breast cancer younger than the age of 45, you should start getting your own mammograms about 5 to 10 years younger than the youngest age of breast cancer diagnosis in your family. Does exposure to air make a tumor spread? No. The thing that makes a breast cancer spread is lack of treatment. So a biopsy, surgery to take care of a cancer does not make that tumor spread. Does stress cause cancer? Well, there probably are some connections between the chemicals, the substances that circulate as a response to stress, and these can be associated with cancer, but unfortunately we don't have the magic recipe for taking stress out of our lives. Definitely an important message to try to lead a life where you minimize stresses that can be avoided. Diet is important in avoiding breast cancer. You want to have a healthy diet and you want to follow a good exercise regimen to avoid obesity and to avoid breast cancer. Brasiers do not cause breast cancer. There are medications that can lower the risk of breast cancer in high-risk women, but these medications do have side effects, and so most women do not end up wanting to take them. But it's a good idea to talk to your physician about these options. Do hair products cause breast cancer? There have been some studies linking hair products like dyes and relaxers to breast cancer risk, but they are not definitive, and so I would not say that women need to necessarily avoid these products completely. Now, we all know that COVID is now added to the very long list of many diseases that have a higher morbidity and mortality in the African American community. And as we start to see some economic recovery from COVID, we have to remember that that recovery is not being experienced universally. And the unemployment in the post-COVID area is still substantially higher in African Americans compared to white Americans, as shown here. So it's important for the cancer advocacy community to work closely with the COVID public health community. As we were treating COVID, our breast cancer screening programs were placed on hiatus. And now as we try to recover from COVID, we are going to be implementing vaccine programs, treatment programs. We have to work closely together to make sure that the COVID clinical trials, just as we need for the cancer clinical trials, that they have diverse accrual, and we need to have African Americans on these studies. We need to have disparities research questions embedded in the COVID research studies, such as looking at genetic ancestry. We need to make sure that aggressive mammography screening programs are returned in the African American communities, and we have to make sure that our safety net hospitals are supported so that they can continue providing safety net care to cancer patients, just as they provided safety net care to COVID patients. And as said by the Reverend Dr. Martin Luther King Jr., of all the forms of injustice, inequality in healthcare is the most shocking and inhumane. And this quote from Dr. Martin Luther King Jr. is especially poignant today because we all woke up hearing about the loss of the incredible Representative John Lewis. And here in closing, just a few photographs of John Lewis crossing the Edmund Pettus Bridge, receiving the Medal of Honor from President Barack Obama, and more recent photos of Representative Lewis crossing the Edmund Pettus Bridge with Barack Obama. And in modern day, we've come a long way, but much to do, and we can most importantly honor Congressman Lewis by remembering to vote on November 3rd. So I thank you very much for your time and attention.